all the scientific stuff right out there, Google or whatever, tells you 40 hours a week. And I was pretty dogmatic. Nope, that's the answer. That's what Lavasse studied. That's what he needs, 40 hours a week. And I was um, pretty dogmatic about pursuing exactly that. Well, TRICARE didn't authorize that. So to answer your question in soundbite, TRICARE gave us that many hours. I wasn't happy with it. We looked for more, but then when Sarah and Natalie came in, I said, no, for a 2-year-old, that's about as much as they're going to be able to take. So this whole notion of doing 40 hours a week, particularly with a really young kid, is ludicrous. 40 hours a week, that's a job, right? And no insurance company is going to cover that. So just be ready to accept, as we did, whatever hours you can get, and you'd be surprised how beneficial they can be. So we got about, I think, 12 hours a week is what we started with, if I remember correctly, somewhere in that ballpark.
And we maximized on that by the parent training that was offered. That's a huge component of ABA. It's not just discrete trials. It's parent training. It's natural environmental training where it looks like preschool. But think about it. Preschool is where our young little kiddos are learning to socialize, to follow instructions from other adults they've never met before, to identify these little objects and talk and use words to ask for what they want. So there is a value to this with our young learners. So the parent training that Natalie and Sarah provided has helped me to get that and helped me to deal with those problem behaviors early on with the aggression, not asking for what he wants. I don't know. All he's doing is hitting me. He knew one word, cracker. So we worked off the cracker. So I made little pictures, put them on the refrigerator. And I just started doing what I found out later, and as they tried to teach me, is a procedure, just like the discrete trials that everyone wants, that is based off ABA principles where I'm shaping up behavior. I am, modeling the word, say cracker, after he's picked it up. And then once he says it, he's imitated, boom, there's cracker. Suddenly I've just hit a contingency that what I do gets me what I want. And if you have it decked out right on the reinforcement scale, it's a lot easier than hitting and screaming and crying. So maybe I'll just say cracker, and maybe I'll just get a cracker. So this is a very valuable thing as parents that we need to understand and help with the therapist. This is a whole picture approach